My name is Rachel. I am the head of coaching with Agave Health. At Agave Health, we provide comprehensive care for adults with ADHD, including diagnosis, therapy, and coaching. And today we want to talk about something that we hear pretty often in the ADHD space. And it's ultimately that, traditional talk therapy sometimes misses the mark for adults with ADHD. And they may not be able to exactly put their finger on why, but traditional talk therapy can leave them feeling frustrated, overwhelmed, misunderstood, or even, reinforce feelings of shame. So today I'm joined by one of our Agave Health therapists, Tracy, and we're going to speak about what a more inclusive approach can look like. So Tracy, please feel free to introduce yourself, tell us a little bit about you and kind of what brought you to Agave Health.
Sure, I'm Tracy Birkinbine. I'm a licensed mental health professional. I've been licensed and as a counselor for about 20 years now. And I am originally from the Midwest, but I live in Florida now. And I've had an interest in helping people all along with an understanding of how their minds work. I love helping people understand themselves more and how their minds work. And as I started to work more closely with individuals who have ADHD, I realized how misunderstood the condition is, not just by the general public, but often by the individuals themselves. So
Very
that
true.
was really fascinating for me how people who were struggling with ADHD didn't often understand it completely themselves. I have three of my children have been diagnosed with ADHD, and a couple of them only as adults. So that's also been really fascinating for me to work with adults who are struggling with ADHD, as we often just hear about children when it comes to ADHD. So I've seen both the struggles and the incredible strengths that come with ADHD, and that personal insight that I've had also with having it in my family has really fueled my passion professionally. Supporting people with ADHD means, I think really empowering them to see their full potential.
Absolutely. You know what? I think up until today, I hadn't heard like your personal connection to ADHD. Just we haven't had the conversation yet, and I find it so interesting that so many people that work in the ADHD space, it's because there's some kind of personal connection. It's not like I don't have ADHD. I don't know anyone that has ADHD, but I'm still interested. It's very much a personal venture for for professionals in the space. And um I'm just I you know I'm glad to know that about you now, and it makes so much more sense. And so that was, my first question is this ultimately what drew you to supporting ADHDers? And it seems like it's been a very personal journey for you. So my next question was, what what is ADHD informed therapy or ADHD inclusive therapy? What is it exactly, and how is it different than just the traditional talk therapy that you think of?
Okay, great. I love that question. At Agave, we tend to do ADHD informed therapy, which, putting it very simply, it means that as a therapist, everything that I work on with people, we are doing it keeping in mind that ADHD is there. So we're going to work on something, but we're also going to keep in mind that there might be some struggles with ADHD that might be affecting this treatment, this exercise. And so it takes into account the unique neurological profile of individuals with ADHD. So, unlike traditional talk therapy, a lot of times with talk therapy, we focus on insight and reflection. ADHD informed therapy can be more action oriented. So, you're actually seeing some results. It's more structured, more dynamic. It kind of blends psychoeducation, so learning about it, understanding it more, emotional regulation, and executive functioning tools. So we try to take all of that into account. But many times, ADHD clients struggle with traditional therapy because it may not meet them where they are. Sessions can lack pace or structure, or even the practical application that they need to stay engaged. and oftentimes they really want to see progress. And so with talk therapy, sometimes you're just talking and you don't really see any action or progress taking place. So the ADHD informed therapy, we want to make sure that we're trying to keep them engaged, helping them to see the progress that they've made themselves. And it also recognizes, their needs and adapts accordingly.
That's really interesting because what you're sort of describing is something that I'm trying to like uh I'm trying to help my therapist help me. So it's like I don't have a pen and paper. This isn't written down. Can you email me that we were just talking about so that after the session's over, I don't immediately forget about it? Um, and she's been, my therapist has been really great in that regard. But I can't imagine how much of just like a sigh of relief it would be to know that that's kind of like built in to the formula. And that, that is something that's always top of mind. So, like I kind of have to throw that out there every now and then. It's like, let's make this more accessible, please.
Yeah, I agree.
So you kind of spoke about this a little bit already, but what are some other reasons why an ADHD, or sorry, my cat's being naughty, why an ADHDer might struggle with traditional therapy? So you said it's very insight and not so much action oriented. Was there anything else that comes to mind with there that might miss the mark?
Well, with talk therapy, many times we're just letting our clients talk about whatever they need to talk about, get it off their chest. Many times it feels like, for me as a therapist, many times it feels like we're just having a conversation, like you would have a conversation with a friend. But without there being that structure, people with ADHD can really get frustrated and feel like it's more of a waste of their time because they're not seeing any progress. They're not
Mhm.
seeing any structure. So for them, just talking and talking and talking doesn't make any sense to them. Now, on the other hand, though, I do have some clients who prefer to talk and talk and talk as if I'm their friend, which is okay, like I said, but sometimes it can be a way that they are trying to get out of really working on the true things that need to be addressed. So I'll find that the clients will just talk as if we're in talk therapy, and it's because they're really trying to postpone or delay working on some of those strategies that we need to be working on for them. So I think going into it, ADHD informed therapy is going to have more of a structure to it. We use unified protocol, and that allows us to really take a step by step approach and have a method and a program that has been known to work really well for people who have ADHD. It's very structured. It gives our clients and members something to do. They can either do it in session with us or they may have homework to take home. So it's very structured, gives them something to do. And hopefully throughout the week and the next time that we talk, they can see progress. And even if they don't, many times I will see the progress and I'll point it out to them so they can see that they actually have been making progress toward their goal.
That's really interesting because I one thing that we hear on the coaching side of things is just the feeling of not making progress because whatever the big goal necessarily hasn't been achieved. So the little steps along the way, they aren't as fulfilling, and that's something that we really work with our members to help them to see. It sounds like you're doing the exact same thing on the therapy side as well. And so like one of the things I'm hearing, I just kind of want to call out is it really sounds like accountability is built into the therapy process, which I don't know, like sometimes when you think of traditional therapy, you don't necessarily think of the therapist being the one to hold you accountable to making progress. It's more like you more think of like they're there to guide you to make progress, but not so much like, okay,
Mhm.
there's a plan, there are, these are the things that you said you're going to do. Have they been done, that sort of thing. And that's something that we work with on the coaching side day to day as well. In terms of accountability, how might it be different? in the therapy side? Sorry, I'm going off script. I'm just
No.
interested.
Well, when I first start working with someone, I send them a document where they can start to write down what goals they would like to work on. So that's the first thing that we do. And then I also ask them to take those same goals and put them in an order of preference. Because I don't know how many times I've made the mistake of assuming that I knew the goal that they wanted to work on first, and it was completely different. So I like to see them write down their goals and write down in order what they would like to work on first. So we'll take that first goal and we'll start coming up with a plan, a treatment plan, to where we really can start identifying, the needs that they have, what's going to help them, maybe some of the underlying issues that are keeping them from achieving those goals. And then I try to give them something to work on through the week, something that they can use as an observation. A lot of times is what I do at the beginning. Give them something that they can do during the week to start paying attention to things that they've never paid attention to before. We come back together and we meet, and I will then ask them how the week went. And many times they'll even send me some notes in between our sessions, letting me know how it's going. But I will talk with them and say, okay, so how did it go? And you said you were going to try this, and were you able to meet that goal? Sometimes we'll just, give one tiny goal that, can seem inconsequential, but when they are able to achieve that one tiny goal, sometimes it encourages them and motivates them to go on and do more. So starting with something really tiny can sometimes lead to them going forward and even completing more than they anticipated. So when we get back together in session, I will talk with them and ask them how much they've done. And, if they have done it, that's wonderful. If they haven't, then if it's something we can do in our session together, we will do it in session, because I want to make sure that they have that chance to work on it and start to make some progress. So if they haven't done it during the week, I usually kind of call them out on it and we do it together in session.
Accountability. It's is necessary for ADHDers.
Yeah.
I know it personally helps me so much. Um, oh, I kind of want to go off script again because you had mentioned something that was on my list. So, I'll go in order. It's fine. Changing the subject a little bit. What are some of the lesser known symptoms of ADHD that you might encounter in your sessions? Because we often think of ADHD as just being, having trouble focusing, um, and completing tasks. But what might come up in therapy that we don't typically think about as a symptom of ADHD?
Right. We think of focusing, lack of concentration, hyperactivity, of course, is we all think of when we hear ADHD, many people think of a kid who's hyper running around and
Well, of course.
inattentiveness, But yeah, in working with adults, some of those lesser known symptoms, can be emotional regulation, that they really have never been able to dive in and learn about their emotions. Some people have never really been able to appropriate express emotions in their lives for whatever reason. They can have blindness, which is, one of the ones I
Know that
deal
one.
with the most. So that would be, really having a hard time estimating how long it's going to take you to do something. I don't know how many times I hear that where they think, they know about how long it's going to take them to do a task, and then it ends up taking them so much longer. And so then they start running out of time and then they're late. So the time blindness, also just losing time as they're hyper focusing on something. The struggles that you have with planning, just going through your day and planning and transitioning, making deadlines. Those are some of the things. Rejection sensitivity, you don't often hear about that too much unless you're in the world
Mm,
of
yeah, of
ADHD. And
course.
so, yeah, having a strong emotional pain that's associated with perceived criticism or disapproval. So people might, not want to take chances or take risks because they are afraid that they're going to fail or they're going to let other people down or get criticized for it. People might even decide to not try to start new relationships or new jobs or new activities, new hobbies because of that. And then that can lead to low self esteem. and people pleasing behaviors, which they are quite good at people pleasing. So you see that a lot with ADHD. And then sensory overload too. That's not something that many people think about when they first hear ADHD, but having an increased sensitivity to sounds and lights, crowds, being around people like that, they can feel angry or irritated, even anxious when they're in environments that are overstimulating for them, and they may then need that downtime, that quiet time to regulate, which is totally the opposite of what we think, because we think these the people who have ADHD are like hyper and on the go all the time, and sometimes that can be the case, but other times they may need that quiet solitude, so that they can regulate themselves again, because if they don't take the time for themselves, they can really activate emotional shutdown or irritability without even understanding the cause.
It just, some of those days when it's like I wake up and I'm immediately thrust into taking care of the animals, taking care of my son, and I'm tired and trying to get the day going. I know I've got work, I haven't gotten myself ready, and just everything coming at me all at once. And my son he's almost 10, so he can be loud. And sometimes I'm just like, I notice myself snapping in the morning because I'm like, I think this is just too much too soon. And working on trying to just take it a bit slower in the mornings and see what I can do so that it's like I can regulate myself a little bit before I start my
Yeah, absolutely.
and I didn't even necessarily realize that that's what it was until you just said that. So thank you. I learned something about myself today. Um, I wanted to ask you, because you were talking about some of those lesser known symptoms. When that happens, or when you see that, what are, sorry, why might adults with ADHD who are presenting to therapy be misdiagnosed with anxiety or depression, whether or not they're presenting to therapy or to their doctor or a psychiatrist, what have you? Um, what ends up happening that allows that misdiagnosis to happen?
Right. And it happens all the time. So people can be going through life and they may be diagnosed and be treated for anxiety and or depression, and it could be found out later in life that those have just been symptoms of ADHD or even OCD. They can be symptoms more than just a diagnosis. So a lot of times, yeah, we jump right to those as disorders, but they could actually be symptoms. So, there's a lot of symptom overlap between anxiety, depression, and ADHD. So, there's chronic a chronic sense of being overwhelmed, having low motivation, restlessness, underperformance. Sometimes those can look like depression and anxiety. But for many adults with ADHD, the real issue is executive dysfunction. They're just having a difficult time getting through their day, getting through what needs to be done in a timely manner on a day to day basis. So they have difficulty organizing, initiating, or completing tasks. And think about it, over time, that's going to lead to anxiety, because if you're falling behind and you know that you have all of this stuff to do, but you're just not able to complete these tasks or get them done on time, you're going to start having some anxiety from it. And honestly, enough anxiety can lead to depression. So if we don't identify the root cause as ADHD, we end up treating these symptoms without really addressing the underlying issue.
And that makes so much sense too, because like I'm just thinking about, okay, you go to the doctor, you're feeling anxious, you're feeling depressed. Okay, here's an SSRI. And you're like, okay, I'm feeling a little bit better, but it persists, right? It doesn't fully go away.
Right.
You're still feeling like failure's just around the corner. Like you can't keep up. And you start to internalize that feeling because all right, well, I'm taking medication or I'm addressing the anxiety, the depression. But at the end of the day, you're not addressing the ADHD. So why would you fully like get better in that instance if the root's not being addressed?
Well,
Um,
also, I, I see people who, have some of the traits of ADHD, but they're being misunderstood by other people as rudeness, disrespect. So like when you have ADHD, some people can have a tendency to blurt out answers or interrupt conversations or try to finish people's sentences for them or answer a question before it's finished being asked. And, I've talked with people who have said that as they were growing up or even in adulthood, they were told that that was disrespectful, that was rude. They were being, disrespectful and rude to that person, or if they are not able to make things on time, that's disrespectful to the other person, it's rude. So many times the people that I talk with who have ADHD have been going many years kind of being misunderstood. It's exactly the opposite. They're not wanting to be rude or disrespectful. It's just that they're so excited about what they want to say that they want to make sure that they get it in there and that they want to be a part of that conversation. So it's the opposite. They just really want to be a part of it. They want to add something to the conversation, not be rude or disrespectful. So yeah, it is so often misunderstood. And if you've been around people who are constantly telling you that you're rude, you're disrespectful, um, you don't place priority on other people's time, then it can really start to eat at you and cause you anxiety. Then to like make sure you're not doing that, trying to hold it in and not interrupt or, so that anxiety really will start to get to you. And so it's no surprise that people would feel this anxiety and depression
yeah.
even without knowing they have ADHD.
So something that you were talking about, like the coping mechanism there, sounds a lot like hypervigilance, trying to make sure that you're, reining in your impulses by always looking for them. What are some other, whether they're healthy or unhealthy coping mechanisms that you might see in someone coming in with ADHD?
Yeah, they are, usually always masking in some way. They're trying
Yeah.
to hold back who they really are and feel ashamed, about who they are, even though those some of the things that they're trying to hold back are some of the most beautiful things about them. So, as I mentioned earlier, people with ADHD can be perfectionistic. They can be hard on themselves. They can really develop high levels of people pleasing to mask their struggles. So they're constantly trying to be aware of how they can please the other person, not hurt the other person. And so even if it's holding things back for themselves. And so, some of the coping mechanisms is they'll rely on urgency to get something done, or procrastination. Like they know that something's got to get done, but they procrastinate over it, or they'll use adrenaline to get through tasks, whatever it takes. I'll also see a lot of burnout from people, and self-doubt, difficulty with routines and transitions, through their day, because they're just constantly thinking about what they're doing and aware of what's going on around them and not wanting to let other people down. But then in turn, it's really starting to cause them to have low self-esteem and self-doubt. And I think, the coping mechanisms often help them it helped them to survive certain environments that didn't accommodate their needs, but they get to a point where sometimes they're no longer serving them. So it can be really difficult. And, therapy is about helping them shift towards sustainable supportive strategies instead of just those quick coping mechanisms. Certainly, those help you to get through rough times, but we need to really dig deeper and come up with some supportive strategies that are going to get at those root issues.
We want to thrive, not just survive.
Yes, absolutely.
Thank you so much. Um, I lost my spot there in just a moment. Sorry. Um, When you're working with someone who has ADHD, what sorry, I phrased my question really strangely for
Yeah.
my own self. Um, I mean, you and I, we've had this personal conversation before about how coaching and therapy can work together. Um, when you're working with someone who is only able to participate in therapy, what sort of gaps do you see that might be able to be filled by coaching?
Oh, yeah. Well, it might be easiest just to kind of talk about how they're similar and then how they're different and how they can complement each other, if that's okay.
Yeah, no, perfect.
Yeah, I
Set the
think,
stage for me.
well, some of the overlap between coaching and counseling can be in areas of like goal setting and accountability, like we talked about, developing life strategies. I think, both the therapist and the coach are going to want to work with, their client on those things. Um, Therapy tends to go a little deeper, so it, can address trauma, core beliefs, other mental health issues that they may be dealing with, and emotional regulation. What I love about coaching is that I really like how it's focusing a lot on the present, mindfulness and like, what can we do right now to help you through this situation? And so it can be more present and also future focused. So therapy might go a little bit backwards. Let's look at where this might have, stemmed from. Let's dive a little deeper, whereas coaching can really look at the here and now, what's happening right now that we can help you with, and then let's look at this going forward too. um, I think especially with ADHD informed therapy, you can incorporate coaching elements into it while also offering a space for deeper healing. But I really like the fact that Agave does both coaching and therapy because I think ideally they complement each other so well. So, they're both going to help clients manage ADHD related challenges in life, of course. The coaching, I like that the coaches have such great practical tools. They have such tricks and tools in their tool bag, for time management and routines and organization. They are able to really emphasize action and structure and follow through. And I often describe the coaches as their cheerleaders, because they are there to make sure that they succeed and to hold them accountable. And I just love that because it's real time accountability. Now, therapy, on the other hand, it's really good because it can address emotional and psychological factors. So, like we said, the anxiety, the depression, shame, even trauma, PTSD, and it can dive a little bit deeper with emotional regulation and deal with some of those deep rooted self-esteem issues that they may have learned through the years, and then also help them find insight into why some of these things have happened. So, we can process trauma and life history and other mental health diagnoses that they may have had. But of course, the best thing, and what complements each other the best is a team of coaches and therapists working together for the client. And I know not everybody can do that. But, when you're able to use both, the coaching can help the clients act, and the therapy then can focus on helping them understand and heal. And so it's really a nice complement. It's comprehensive support, right? You've got it on both
Exactly.
sides. I love it. And it covers both behavior and emotion. And so it's so ideal. I just think, it's really awesome because then clients can have support for what they do and how they feel. For me, I tend to use a lot of cognitive behavioral therapy, and we use the unified protocol too for our therapy. And what I've liked to do, I love cognitive behavioral therapy because it really helps you to reframe, just stop and reframe the situation, reframe your thoughts. And so one of the things that I love to say is embrace and replace. So let's
Oh, I
embrace
love that.
the ADHD, but then let's replace those negative self, thoughts, those negative behaviors, the negative self talk that we do to ourselves. So embrace the ADHD, because it's not something to run from, it's not something to be upset or ashamed of, but you want to then take those negative thoughts that you might have been have happening, and then replace those with more positive thoughts and more, aspirational goals. Because, people with ADHD are not any different. It's just their brain is wired just a little different. So I mean, they really should embrace ADHD, because there's so many wonderful qualities that ADHD can bring to a person. And I really encourage them to like work with their brain, not against it, because it has a lot of great attributes. So.
Absolutely. Like being on the coaching side and working with people day to day, we see the creativity that they bring to the day and to their work, and just the unique perspectives. Um, I love being able to hear from my team, just the way they're able to help people bring out those positive attributes and work through the challenges. But at the end of the day, I just want to say we're also so grateful to have the therapy team as well, because, things come up that as coaches we're not equipped to help people work through. And a lot of times it can be challenging because stress and anxiety kind of go hand in hand.
Mhm.
And it's, sometimes it's like, okay, this isn't just stress related. This isn't something that we can, you know, throw tools at for executive dysfunction and have it be resolved. It's ultimately something that requires an additional layer of support and um someone with the background and the licensure to address. So we're grateful that, you guys are there to help with those challenges. And we're so grateful to be working with you as well in terms of, how we can expand upon what's going on in therapy and help people get to those goalposts that they're setting for themselves.
Well, Rachel, I know
Um,
you asked some about, if somebody was doing therapy only or coaching only, and I'm not sure I answered that completely for you, but
oh,
I think
you're
that,
absolutely right.
well, I think that, when somebody um, is in therapy that's not ADHD informed, they may gain insight, but not the strategies to help them with it. And if they're in coaching only, they might make progress with goals, but then still struggle with those unresolved emotional patterns.
Absolutely.
So there can be some gaps there if you're only using one or over the other. But I mean, mental health should be treated with the same importance as our physical health. I mean, the goal isn't to fix ADHD; it's to understand it. It's to embrace its strengths and find ways to work with it instead of against it. And, that's ultimately what leads to a more fulfilling and productive life. So,
Absolutely.
yeah.
Well, I see we're a little bit past time here, so I just want to say, Tracy, thank you so much for having this conversation with me today. It's such an important topic, and like now that I've learned a lot about like how ADHD informed therapy is different, like I'm looking at therapy in a new light. And I hope anyone else that joined us live or who is watching the replay can have a similar experience, um, and that this just ultimately sheds some light on the ways that therapy can be more impactful for the ADHD brain. So in closing, I want to remind you that at Agave Health, we believe that your ADHD care should be comprehensive beyond just diagnosis and medication. And that is one of the reasons why we've added therapy services to what we offer, because we know that coaching alone, tools alone, medication alone, those things, it's going to take a more comprehensive approach for people to get ultimately what they need out of ADHD care. So we do offer ADHD-informed therapy in select states at this time, and we're constantly working at expanding that to more states. And if you'd like to learn more about our therapy services, we also offer evaluation and diagnosis services. You can read more about those on our website. You could also leave a comment, and we'll be happy to get back to you with those resources if you would like. But once again, thank you so much for joining us. And Tracy, thank you so much for having this conversation with me.
Thanks for having me.
Absolutely.